Hi again, I'm Matthew Conley, and I chose Gigantism as my endocrine system video. Gigantism is an excessive or abnormal growth during childhood. It's caused by an adenoma or benign tumor on the pituitary gland. Most of the time that's how it's caused. It can also be caused by Mercure-Albright syndrome, Carney complex, or multiple endocrine neoplasia. So basically, gigantism is the excessive or hypersecretion of growth hormone before the closure of the epiphyseal growth plates on your bones. This is what causes the bones to grow longer and bigger. So basically, this hypersecretion directly affects carbohydrate metabolism and fat metabolism, and this causes an increased blood glucose and other anti-insulin effects, and also increased fat breakdown and release. The indirect effects are it's processed in the liver and other tissues, the growth hormone is, and this produces insulin-like growth factors, and this causes increased cartilage and skeletal growth, and increased protein synthesis and cell growth and proliferation. So yeah, like I said, this is all done before the closure of the epiphyseal plates, growth plates. If this excess growth or hypersecretion of growth hormone occurs after that in adulthood, that is what is diagnosed as acromegaly. So the symptoms of gigantism are large hands, large feet, prominent jaw and forehead, flat nose, sweating, delayed puberty. And in order to diagnose the disease, first a blood test is done to measure things like insulin growth factors to see if there's an excess of those, and then magnetic resonance imaging may be done to get a better view at the adenoma on the pituitary gland, or a computed tomography scan or CT scan. So treatment, surgery is oftentimes the most effective way to treat this, and this surgery is called a transfundial hypophysectomy. Yeah, I said that right. And yeah, so this is basically just the removal of the adenoma on the pituitary gland. However, as a result of this, individuals often suffer from hypothyroidism, hypogonadism, adrenal insufficiencies, and diabetes insipidus, just because you removed part of the pituitary gland and can't release as much hormones. You can also take medication or injection of somatostatin just to suppress the growth hormone. And also there is the option of radiation therapy, which isn't as successful as the surgery. So yeah, that's my video on gigantism. I hope I covered everything, and thank you.